Welcome, everyone. My name is Coletta Dorado. I'm the founder and CEO of AZZLY. Thank you for joining today's webinar. As an all-in-one mental health and substance use disorder EHR, practice management, and revenue cycle management platform, we tackle some of the most frustrating pain points that face healthcare providers, UR specialists, and billers. Your experience and feedback keep making us better, so I really thank you for that, as does the team. If you joined for our previous webinar on prior authorization, we had a fantastic turnout, and we discussed the crucial role of prior authorization in behavioral health billing, and answered some common questions. We can share that link with that recording with you if you have interest. Just reach out. So when we ran a poll, and you might have seen it when you first logged into the webinar, approximately 3/4 stated that they could not manage prior authorizations in their current EHR system. So we wanted to share an opportunity and offer an opportunity to show what we've built in AZZLY Rise. Most are doing it on paper, most are doing it a manual process, and there's a lot of room for human error. So we really pride ourselves on what we created. And today we've got Heather Jenkins, our prior authorization specialist. She's got more than 15 years of experience. She's going to walk you through it. So Heather, take it away.
All right, thank you, Coletta. And I'll share my screen. That way you guys can see the flow of AZZLY and exactly how we help you manage your prior authorizations. And the importance with this is the beginning of your RCM, your revenue cycle management. So this is the start of the cash flow, and if this piece is missing, that disrupts you actually receiving your checks. In order to allow AZZLY to help you with your prior authorization management, you'll come into your client app. And you notice that you've got your active patient list on the screen that you see before you with EMR numbers. The first thing that you would need to do in order to utilize the managing system is to use the sorting arrows at the top and let the system show you the most current EMR number that's your new patient admit. This tells your biller or your revenue cycle team that they have a new admit that most likely will require a new prior authorization. When you open the chart, you can verify that prior authorization and make sure that there's not an existing one using this insurance tab and going to the add auth. You can see here that all of your information is listed. You've got your payer name, your start date, your total visits, your left visits, expiration, days or units, and then of course the number. And we'll talk about this more in just a moment. The prior authorization submission process is unique for every payer. So whatever payers you are credentialed or enrolled with, I recommend that you go to their website and get their rules and regulations for the prior authorization request. And I'll show you just an example of exactly what you'll see on those payer websites, You can see here an inpatient residential substance use disorder prior authorization request form. All of these will be different for each payer. This is just an example. And they also will give you the instructions that they would like for you to follow to correctly fill out each and every prior authorization request. So just remember to utilize those payer portals, go into your provider links, get those instructions so that you don't make mistakes and mess up this prior authorization request. Once you get the request filled out appropriately, you will come into your eChart in your AZZLY app and collect all of the clinicals necessary for your prior authorization. It's a very simple click of that square and then the line item that you would like. And this will allow you to fax directly from the AZZLY system all of the clinicals necessary for your prior authorization request using this fax icon at the top, your eFax. This allows you to keep a record of the faxes sent, the request sent, and this is important because you need to be able to prove your timely request. Most of the PA requests need to be submitted to the payers within a 48-hour window, or they consider them to be untimely and will not give you approvals for whatever day range you have missed. Once you enter your number here, your insurance subscriber ID, you will attach those documents and also upload your PA request forms that you have filled out from the other screens and saved. Once you have faxed this out, AZZLY keeps a record of that fax for you, essentially a fax confirmation sheet showing a date, time, and the pages that have been submitted. So we go through that process, we submit clinicals. In a perfect world, we get that prior auth approval. We now come into our insurance tab, open this up, go down to our add authorization screen, and we want to go through this window with more information and detail. We'll give this just a moment to load. So our most recent prior auth, and you can see a history below, which will always be memorialized here in the patient chart. You've got your payer name. You'll add the auth number here from the approval letter. You will add the total number of days or units that the payer has allotted for you, and you can choose between those two drop-downs. You always have a date range associated with that prior authorization number. That can be entered here using the calendar icons. You can also set a review date, and that review date is a reminder for your biller to request an extension or submit discharge clinicals or concurrent reviews. Your charge master, which is set up for you by our RCM team, allows you to tie this specific for your prior authorization number to a service that it's approved for. So IOP, residential 3.3, 3.5, whatever you have submitted this request for. Once you've saved this, it will display below. And please take notice of the total visits and left visits. The total visits will always be the units or days that were given to you by the payer and authorized. And your left visits provide a view of a countdown. So each and every time that we tie this, or you as your biller, tie this prior authorization number to a claim and drop that claim to the payer, a unit or day will fall off of your left visits. This is a wonderful, wonderful tool for your biller to show exactly where this patient is with their used units so that they know when to submit for more or request additional days for this service rendered. I'll show you exactly how easy that is to attach it to a claim and how foolproof AZZLY has made this process for your billing team. We go into professional claim. We also offer the institutional option. You'll just start to type in that first or last, choose your patient from that drop-down menu, and notice that all of the information auto-populates. This is part of that foolproofing that Coletta was talking about. We try to automate as much as we possibly can, pulling from that patient chart so that we reduce human error. You want to make sure your start date is correct. Your diagnosis will pull in from your patient chart build, and then you'll simply go into your charge master, find that service that we were approved for with our prior authorization, click the plus sign, the service comes in, your auth will populate here in this claim level information. And notice as you hover over this information, your biller can see the exact date range that this pre-authorization was tied to and approved for. Now, let's just say we forget to do this. If your biller or your RCM team tried to finalize and send this claim, actually AZZLY would actually come in and prompt them and say, there's no prior auth tied to this. Are you sure you'd like to proceed? So that's just another stop for your billers to notify them, hey, we've got this claim that's trying to be sent out. It needs a prior auth to come in on it. Please go back, make sure that information is filled in so that this claim may go out cleanly. Once it's tied here, you can see 1 of 10 has been used. When this claim is dropped, it will display as 2 of 10. So we'll actually do that. Give it a moment to think. And now when we go back and we open the patient's chart, you will see in the auth section that we've now reduced our visit by 1 more. So each and every time that's tied to 1 claim, it goes down by 1. What we recommend doing is each and every week, either on a Monday or a Friday, your billing team comes in and runs a report that's specific to your auth management. In your billing report section, you'll go up to authorization alerts, click display report, and the report that you see on your screen now will populate for them. So it gives them a 7-day date range of what auths are coming due for either the reconsiderations, extensions, or it tells your team that discharge clinicals need to be sent. It also tells you when 80% of the units have been used in the K column here. So this is a huge tool for your billing team. They run this on a Friday. It allows them to forecast the next week, what needs to be done with their prior authorization approvals, what work needs to be completed before those discharge dates come due or the reconsiderations are necessary. Go back to this home screen. The clinicals that we normally see tied to these prior authorizations, because these are all stored in this patient chart for AZZLY, are very, very easy to pull in and send. And remember, as you compile your case, you are essentially telling a story to the payer. You are proving medical necessity. And AZZLY makes it very easy to come in and select those clinicals that you need and send those out. All right. And that wraps up the demonstration of the AZZLY portion. You can see that it's very user-friendly, very easy to come in and manage those prior authorizations, know exactly where you are, where you stand with each of those approvals, and do what's necessary to request extensions or send off discharge clinicals.
Great. Heather, thank you so much. And just, a recap. As in anything, when you're doing data collection, garbage in, garbage out, it's really important that the information that you enter, those units, the number, if you start with the right number, it will count it down. The other thing, as Heather mentioned, an added feature we've placed in AZZLY is the outbound EFAPs that does provide a cover sheet and lists everything that you're sending to that payer, as well as the ability to store it in the patient document area, so that if you don't get the prior authorizations from the payer, you have the ability to do that follow-up, as Heather mentioned, and resend it with the cover sheet, with the date and time, and the EFAPs that they gave you, and the contact, so that you can really follow up. We know it's a lot of work, but we also know it's one of the most critical components to you all getting paid for the services that you rendered. So we're here for you. We look forward to having you join us at on other webinars that we'll have scheduled, again, starting in the beginning of the year. And just reach out to us, clientservices@azzly.com. If you want more information, you want a one-on-one consultation, you have more questions on prior auth. Heather is our star in that department. She's a pleasure to work with. You get nothing but 5 out of 5 star ratings on the quality of care and service that we provide. So want to thank you for joining us today. It's a short and sweet presentation. We value your time, and we really thank you for participating. Again, Heather, Andrew, thank you.
Thank you.